Hey, how's it going? I'm just going to start off. I'm not very good with words here, so I'm just going to start off with this first video blog of me explaining why I'm down here. I'm down in Milwaukee right now at Kathy's house. It's a place for family members of patients who are in the hospital to stay at. I'm staying here until tomorrow morning, when I go to the hospital to start my surgery. Now, for those of you who don't know what's going on with me, I can explain myself here. Don't know if you know or not, I have epilepsy, and the reason for me being down here is the main objective is to see if that can be cured. There is a two-part surgical procedure that I will be going through starting tomorrow, and it's going to be quite a lengthy procedure. I'll be stuck in a bed for the better part of a week. Now, the reason that this is all happening is because, if you'll forgive me, I've got drawings here that I just made. Not very good drawings, but it should serve its purpose well. I've gone through a good amount of tests in the past year or 2 years, and they have come to the conclusion that, there is a part of my brain. The doctors have found the area of onset, which is where I had a brain tumor removed 25 years ago. Here's a drawing of my brain that I drew. This is the left side of my brain, that you would see it as an MRI. And right here is a cavity in my brain, which is there right now. That's where my tumor was removed from when I was 5 years old. And what happened was, when the tumor was removed back in the 80s, the brain sort of closed in over the cavity. And back in those days, they just used scalpels and everything. From back then, I don't know exactly what they used. But what happened was there was scarring, and a bunch of blood bled into this cavity and was not able to escape because the brain closed in over itself. So right now, there is that blood from 25 years ago is still in my head and has filled up that cavity, and all that blood is right here. It has since, over the past 25 years, calcified and ironized. So there's a big hunk of metal in my head right now. For those of you who are familiar with science, metal does not go very well when it comes to electricity, and epilepsy and seizures that go along with epilepsy is a big electrical storm in the brain. So when I'm having those electrical storms and they're cruising right across the big hunk of metal that's in my brain, that just makes my seizures even worse. So the doctors are going to essentially remove that chunk of metal. What they're going to be doing is they're going to, at first, starting tomorrow, they're going to be placing grids. There's a big one here with a bunch of wires. There's, let's see, there's 4 wires here, 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 and here that are connected to many, many different wires, that each wire goes to each individual electrode that's inside of this grid. There's about 64 of them, and there's a smaller grid with 16 electrodes. There's going to be 2 wires coming off of it, each wire with 8 small wires going to each electrode, and then there are small strips with 4 electrodes in each strip, each and this one wire here has 4 wires coming out of it going to each individual electrode. Now what's going to happen is tomorrow when I go in, they are going to shave me bald. When I start the procedure, they are going to remove a big layer of skin. Then they will remove a rather large piece of my skull, which is going to expose a lot of my brain. Once they remove the piece of the skull, there is a membrane that goes over my brain that holds in all the brain fluid. It's called the dura. They're going to remove that and peel it back, exposing my brain. They will then take all those grids that I showed you here, and they are going to place the big one right here. Actually, let's see, right here on the front of my left side of my brain. The small one right here is going to go over where they believe the area of onset where my seizures are coming from, and then there's going to be multiple different small strips all throughout the left side of my brain. So my brain is going to just be covered in strips. Once that is done, they will keep my skull, the portion of my skull that they take out, they are going to leave out, put it in a bag, or double bag it, put it in a box, label the box, and then put that box in a bag, label the bag, and put it in a freezer somewhere for the week. So I will be without a big portion of my skull for a while. They are then going to put the dura back in its place, and then put my skin back in place, and they're going to, and then that'll just be it. I will have no skull right here, just skin protecting my brain. And then all those little wires that you can see here that'll be coming off of each grid, they will actually drill holes underneath where they cut my cut out the piece of skull. So this is a bad artist's rendering, but I will look something like that. A big old piece of skin flapped over, and then all these little wires will be drilled through my head and will be coming out that way. And then they're going to wrap a big old turban or cloth around my head. I'll be looking kind of crazy for a while. Once that happens, they will take me out of surgery, and they will take away my medication and wait for me to have a seizure. And yes, with my brain exposed, or with my skull not there, they will make me have a seizure. Once, because the seizure will actually light up all these electrodes that are going to be on my head, and the electrodes will actually catch where the area of onset is. They will catch, the doctors believe that the area of onset is right here. So they believe that those electrodes will be able to tell the exact shape, size, and depth of the area of onset. Once they do that, or once they realize what's going on, they'll do some mapping of my brain, and then they will go in the next day, take out all the grids, and then they're going to be using what's called a gamma knife to remove this whole area right here. They're going to remove all that old blood and essentially leave a big cavity right here, but then they're going to make that cavity a little bit larger to take out any access area that they believe my seizures are coming from. There is a slight risk of infection, about 5%. There is a very small chance of me losing some of my peripheral vision in my right eye, which I can deal with. There is a very, very, very small chance of me dying. The doctor said it is so small that they can't even put a number on it. So that is basically everything that I'm going to be going through for the next week. I will keep you posted. If you have any questions, please feel free to make a post on my Facebook wall, or you can, make posts on these videos on YouTube, and just wish me the best of luck. I'll be here, or I'll be making other random posts all throughout the week, so just keep on looking. You'll see all the different stages that I'll be going through. You'll see me, bald as a baby. You'll see me with bandages over my head, and I'll probably be in a lot worse shape than I'm in right now. I'm a little jittery. I'll probably be really shaken tomorrow morning, but I gotta go through with it. So I hope everything goes perfectly here. I hope this ends my epilepsy. I hope my seizures cease to exist and I can just move on with my life from here. I don't even know what's going to happen from here. My life, this is a drastically life-altering event right here that I'm hoping ends very positively. So that's basically about it right now. Next time you see me, I will have already gone through my surgery, and unless for some reason I'm able to make another video blog just before the surgery. Alright, so you all take care. See you later.